guys, welcome back to my channel. So today's video is something that's a little bit different. I recently just had an Instagram live with the wonderful Dr. Zainab, and we had such a lovely organic conversation about our journeys into dental school. Even though we both have very different backgrounds, she comes from a family where her mum was a dentist, her dad was a doctor, whereas I didn't really have anyone in my family that was in that field. But it's so crazy how similar our journeys were and how we both had to face a lot of trials and tribulations to get to where we are now. So I really hope you guys enjoy it. I know some of you guys might have watched it live on Instagram, but I know that there were a few people that probably didn't get to see it. I know Instagram quality is not the best quality, so I apologise, but I just didn't want you guys to miss out. So that's why I've uploaded it here. So I really hope you guys enjoy it, and hope you gain a lot from the conversation too. And if you guys did have any more questions, just pop it in the comments below and I'll be sure to get back to you. So yeah, I hope you guys enjoy the conversation. Be sure to check out Zainab's Instagram page. She's such a wonderful person and I really enjoyed having this conversation with her. Also, a quick update about my vlogs. I know I haven't been putting them out as much as I planned to, but everything's just picked up at work, doing dentistry, so I've just been occupied with that. But I will definitely put them out when I get the chance, so stay tuned for that too. But for now, I hope you guys enjoy this conversation and I'll catch up with you guys soon.
Hello!
How are you?
I'm fine. Thank you so much for joining. We got there in the end.
And I can't wait to chat with you about all this because it's been ages that we've been wanting to do this, hasn't it?
Honestly, I feel like we've been speaking for so long about it and finally getting to do it. It's so exciting. And I know so many people do ask me and you about getting into dental school. So I thought it would be just great for us to have this chat. Most of you guys that follow me know about my journey into dental school. It wasn't the easiest. I'll go into more detail later. But I am currently working as a foundation dentist. I'm loving it. Sometimes it has its ups, sometimes it has its downs. But at the moment, I'm loving it. It's what I wanted to do, and I'm just glad that it all paid off and I'm here at the moment. So yeah, I'm in my first year as a dentist. So yeah, that's a bit about me. Zainab, about you?
So I've been a dentist for the last 10 years. I graduated 2010 from King's College. And I did 5 years of dentistry in the NHS and then private practice. And now what I do in cosmetic dentistry mixed with facial aesthetics, and I combine the two. And I also work as a injector in hospitals. I do teaching of facial aesthetics as well on occasion. There's a lot of two, which always a lot of juggling, but we'll come to that. So yeah, that's in a nutshell at the moment.
Fantastic. Zainab, you're cutting out a little bit, just in and out. It's like cutting a little bit. I'm not sure, is that the best signal?
Let me find a better one while we're just chatting. I'll find it and you tell me if it gets better.
Okay, no problem.
So tell us your story, because your story is very it's not your typical kind of, smooth entry into dental school. You had, a few hiccups, a few setbacks, and you persevered. So tell us your story, because I think it's really inspiring.
Yeah. Okay, so I'll take you guys to the beginning of how I even came about dentistry. So dentistry wasn't something that I'd always known that I wanted to do. I didn't have any dentist in my family. I was very academic. I always pushed to try and get good grades, but I just wasn't sure what I was going to do. So I just, old-fashioned method of just researching, basically. I just looked at my skills. I loved communicating with people. I was very hands-on. I do eyebrow threading. So I was like, okay, so I want something that's quite practical. And I loved healthcare. I knew that I wanted to be doing something that I was helping people as well, because that's something I'm very passionate about. So I just married up all these things together and just researched online, and I just came across dentistry, and I was like, oh, dentistry is not something that I'd really considered before, and it's not a conventional kind of career. So, okay, got rejection straight away when I first applied in 2013. I was like, okay, I'm not going to get an interview. And then around end of December, January, I got an interview. And I was super excited. It was one from Manchester. That was one that I really wanted to go to. Got an interview there, and I ended up getting an offer. So I got an offer from Manchester, got another interview from Liverpool, got an offer. So at this point, I had 2 offers. I was so excited. I was like, oh, okay, all I need to do now is get the grades. So I revised, done as many past papers as I could, and I just didn't want to lose these offers because everybody knows how hard it is to get a dentistry offer. And this is the part of the story where it gets a bit sad. So I had revised, literally spent day and night, and literally just revising, and I was being pretty confident for the exam, you know? And it got to the exams now. And I was really confident. I answered the questions, and the invigilator came over and was like, okay, time's up. And I was like, okay, cool. And then as they were collecting my paper, they turned it around and they saw that there was like a blank page and I hadn't answered a question there. And I was like, wait, what? But I missed a question. And I literally I broke down in the exam hall and just started crying because I did, like, it was just one of those stupid mistakes where it's like, you've done so many past papers, how did you miss the whole question? And it's not something that I'd done before, and by this time the time was up, so they weren't going to let me answer it. And I remember it was a question about like how the heart works or something like that, so I could have easily answered it, but I just didn't see it. And it was a 20-mark question, and at that point I was like, okay, my offer's basically gone. So I was waiting for the results. I had a bit of hope. Okay, maybe I could have still got the grade without answering a whole 20-mark question. Waited, and I was 1% off.
God.
Honestly. And I was thinking 1%, and I didn't answer the whole question. Like, even if I had just written 2 lines, I would have got the grade. So I was really upset, really disheartened. I called the people that I had offers with, and they just said, look, a deal's a deal. You needed to get the A's. You're 1% off. We're not giving you. Yeah, they were militant. I called them time again. I was like, please, can you just let me off? And they were just like, sorry, just going to have to try again. And at this point I was thinking, oh, is it even worth the stress of doing a whole year again? Because it's just disheartening, because when you're someone that you're a hard worker, you put in the work, and just something like that happens, you just I kind of lost faith, and I was really upset. I didn't know whether I wanted to apply again.
But you did.
I didn't want to look like a failure. All my friends were going to university and they'd got their offers, and I didn't want, I had to swallow a lot of pride because I'd have to go back and take the subject for just 1%. And I think in my mind I was thinking, oh, people are going to judge me, and I was just, all these negative thoughts were just piling up in my mind. But in the end I just thought, you know what, I really want to do dentistry, and I'm going to continue to strive for it. And even if it means I'm going to have to take this year out and do it again, swallow my pride, that was what I had to do. So I applied again, second time.
So did you gap year, or in that year you were doing your A-level, that module, that paper, kind of a gap year, right?
Yeah, so I had to just come in to do that subject, but during that year I worked, so I got some experience in retail. I worked in All Saints, I worked in Apple. So I got a lot of retail experience, and I think that kind of helped when it came to dentistry, because you need to be able to have those like sort of communication skills, dealing with angry patients, or in my case when I was doing my gap year, customers. So working in retail and actually taking that gap year, I think it was quite useful, because at the time I was really angry. I'm sure you'd understand. I was like, why is this happening to me, But in the grand scheme of things, it all happened for a reason, and I ended up getting an offer from Plymouth, which is where I studied. And at first I was thinking, oh, Plymouth, I'm not too sure about this uni, because it's one of the newer ones, but I'm so glad that I went there, because everything was so modern, and even though it was far away from London, it was by the sea, and honestly, I had such an amazing time in Plymouth. So it was literally, we could just walk out of our accommodation and we'd just sit by the sea. We were surrounded by beaches, and I didn't know England could be so beautiful.
I know. You know what? Everything happens for a reason. I didn't have had the opportunity to be in such a nice place doing it.
Exactly. So getting that offer, in the end, it just, honestly, I literally cried tears that day when I was like, oh, it all worked out, because I was thinking, I was literally going to throw away my dream of doing dentistry, and I think I was going to go do biomed at Warwick because I had an offer there.
You know what?
I decided to try here. Yeah.
Amazing. It's so inspiring, because for you, dentistry kind of came out of nowhere, because you were looking at careers, thinking, what am I good at? And then you stumbled upon, that option and really liked it. But every step for you was so difficult to kind of jump through, and yet you kept going. And I don't know, doesn't that just give you like an element of real satisfaction now?
Yeah, 100%, because even my YouTube channel, everything that I'm sort of doing now, it stemmed out of that failure. Because I think if I had a, I guess, more conventional journey, not to say that people who have a conventional journey don't do anything from it, but I feel like it just pushed me more, and it really allowed me to appreciate my position in dental school. But yeah, that's my story. But what about you, Zainab? I know yours is very different.
Yeah, very different. And this is why I think this is really interesting, because you've come from a point of view, again, where you weren't introduced to dentistry until you kind of looked for it, but you became really passionate about it, and then you literally, pushed every door, kicked every door until you got there. And for me, I kicked every door until I got there, but it was a different journey. And essentially what happened with me is that my mum's a dentist, so I was introduced to dentistry very, very early on. Okay. And I used to watch her do composite bonding, ironically, which is a lot of what I do now.
Oh, wow. So
more of the oral surgery pathway kind of dentist. She was an implant dentist and did loads of surgery. But the things I was allowed to observe, because you can't really be in there when you're doing implants because everything's so sterile, etc., and it's all kind of theatre mode. But I used to observe her doing composite work, and I just found it so fascinating how in a matter of minutes she could rebuild a tooth, and she had a really artistic way of doing it. It wasn't as fancy as the way we do composites now, with the use of lots of different instruments and materials and so on. She just had a magic hand at doing it. And that was really fascinating. So I was really drawn to that. And then I used to see how she was with patients, and the relationship she was forming with people, and I found that really, really kind of appealing about it. And when it really came down to decision time, it was between medicine or dentistry, because my dad's a doctor, so I was exposed to that as well. But it came down to dentistry was the only career that combined the artistic side, the relationships with patient side, that kind of ongoing relationship, which is really nice, and that science, which I really enjoyed learning about as well, and the flexibility. So I couldn't think of anything better, and I was just like, this is it. This is what I want to do. And I put that into my head when I was maybe about 14. So I knew quite early, so I was ready to start that journey very early. So when it came to doing GCSE, I was headstrong about my subjects. I knew exactly what I wanted to do. Came out of GCSEs with top grades, best in the class, and I kind of got a bit complacent then. Where a big learning point happened, because I then went on to do A-levels, and A-levels are the hardest thing that you will ever do. Harder than medicine, harder than dentistry, harder than engineering.
I've done the international baccalaureate, which I don't know why I decided to do that, because that's even one, we had to do, it's basically like doing 6 A-levels, and I can honestly say those 2 years, they were definitely almost the same as dental school, even harder maybe.
Agony, and I think what it was about it is just the sheer volume and the fact that there was no leeway to get anything wrong, because your life now depends on it, your grades depend on it, everything depends on your grades, so there's no room, and it's a lot more you've got to do a lot more self-learning. So it's not like what GCSE, where you can be spoon-fed a bit, you just go away and learn everything, but here you had to really spend extra time. Now I came out from the GCSE phase with a little bit of complacency and maybe overconfidence.
Yeah.
And I thought, I'll sail, you know, I'll just keep up and I'll be fine.
Yeah, I feel you with that, because I literally, when you're so used to getting like good grades, you sort of start getting a bit, oh yeah, I'll be fine.
Yeah.
You know, you start to relax a bit.
Yeah. And it just so happened, so I was not really doing the level of extra work at home that I should have been. And I was thinking, well, everything's going into my mind. I understand the subject really well, so I'll be fine when it comes to exam time. But there's such emphasis in A-levels on exam technique. You really got to sit there and do past papers like no man's business. You really need to know.
My best friend.
And and so I would just feel like, as long as I understood the subject, then I'll be fine. And I understood the subject, but I didn't understand what they were looking for in exams. And so when it came down to it, I think I was underperforming, but I still hadn't realized it because we hadn't yet had an exam. I was in my AS year, and it was January the 18th. I remember this day, and we had a fire in our house. And I literally had gone to college, and the fire was about 8 a.m. and about 3 p.m. my mum sent me a message and said, we've had a fire in the house in the morning. You're going to come home and find a problem. So don't come home. come and I'll pick you up from XYZ place. Yeah. So anyway, long story short, we had a fire in our home that morning, and my sister Yusra was in the house, and it was 8 a.m. and we had all just left. And yeah, this fire broke out from the kitchen. And it was an electrical fire, but it burnt the whole kitchen down. All the windows downstairs smashed, smoke damaged. If you looked at the house, basically the downstairs was skeletal looking, and all the windows were out. And
how did the fire start? Was it just
apparently kettle? It was a kettle or toaster. I can't remember, one of the two.
Oh my god.
And they said that it was from that. So yeah, I have to switch everything off at night. And yeah, when you go out, if you can try and remember. But so from that night, we were literally uprooted and stayed in a hotel for 3 weeks, and then somewhere else for another month, and then rented accommodation for a year until my parents kind of rebuilt. And that really threw me. It just, already my focus wasn't 100%. It was like I was plodding along thinking I'm doing okay, but this is just a few weeks before one of the AS exams. And so I'm completely dislocated. All my stuff is dislocated, and all my sisters. And it was just really messy. So my focus went. It was more about helping my mum and dad cope. It was more about, let's just get by this difficult time. And I wasn't focused. And then it really hit me, because my AS grades I didn't get good AS grades. So, oh my gosh, I really now got to catch up. So when I came to do my second year, level year, I was super stressed, and I was trying to compensate. But with the A levels, if you don't do well in your AS, you have to retake a lot of modules to kind of get it right and get your grades up where it should be.
Yeah.
When it came to A levels, I didn't get the grades, and
I didn't know that. Was it AS or A2? You didn't get the grades.
Both didn't get the grades. So I got the offer from King's for dentistry. I didn't get the grades, and I can't tell you the devastation. Just unreal. And then,
I feel you. I've been there.
it was honestly just devastation. And I was like, I can't believe this. Like, this is my first failure. I've kind of always been a good student. This is my first failure. And I was like, is this really my fate? Like, is this really not going to happen? I couldn't accept it. And I was heartbroken for a good week. I tried every university. I tried everything. And King's were absolutely militant. You don't make the grades, there's no leeway. Now, I had written to them to say that we'd had a fire in our house, mitigating circumstance, like obviously I was just thrown, you know, and so they kind of took on board that, and all they had said is, you can retake. I don't know, I don't think they do that now, but at that time they did. They said, you can. This is 15 years ago, by the way. Said you can retake.
And you remember it so vividly.
Yeah, you've got to get 2 A's and a B, and you need 2 A's in chemistry and politics and a B in biology, which was a bit bizarre.
Okay.
And I said, I think now they want like 4 A stars or something crazy.
Yeah.
But
They
that
really
was
cranked it up a notch.
yeah. But at
when I
that time,
applied,
that
it was
was hard to achieve. It was really hard. It was like a big deal. I think they've made things. I don't know. I think they've changed the system a bit. But at that point, it was a big kind of hurdle to get. And so I decided I was going to retake, and it was like I didn't second guess it. I just knew I had to do it because it was the only way.
Yeah.
So I took it as a fortunate thing that, okay, well, I still have this new conditional offer. Let me take it. So I went, and my mum really supported me. She was like, you can go to you've got. She kind of just pushed me, and I was like, yep, I'm doing this. You know, it doesn't matter, you know, what anyone else says or what society's expectations are, to just crack on. I'm going to do dentistry, so I'm going to retake. So I went to a college and retook all 3 A levels, but I did it in an intensive course, a 3-month course.
Oh wow!
Hardest time of my life, because the examining boards were different. So they changed, so it was a whole new thing. So it was like doing everything from scratch again, but in 3 months, because the examining boards are different. And I was so stressed but so determined. At 4 or 5 a.m. every morning, would study in the morning. I'd go to college. I'd stay in the library there till 7. I'd get home. I'd miss meals because I was just on autopilot, and I was missing meals. I think I'd have 1 per meal a day when I get home, but during the day it was just like rush. Just sit down. Every minute counts. And I was like, it was really like that. And I lost so much weight without realizing. Just that 3 months, I became a very scary 39 kilos. And I'm not very tall. I'm like just scraping 5 foot.
Wow.
But 39 kilos is so tiny. So I looked like a child. I had lost so much weight, and my family were like, Zainab, this stress is really bad. Just take it easy. And I was like, no, just nobody talk to me for 3 months. Let me just get past this, and then I will be myself again.
Yeah.
I got through it, and I got 2 A's and a B, but I got them in the wrong combination. So I got 2 A's in biology and chemistry, and I got the B in politics. And I thought, oh, Kings will be fine, because at least the sciences I got the A's. And I called. Yeah. They said, no, you haven't met the offer. And again, they were really militant. And I was like, please. And I booked a meeting. I was like, I just went in. I was literally begging at the door. I was like, look, sat down in the admissions office, and I said, I've done everything. Why do you care so much about this politics? I've got 2 A's in this.
Yeah.
Important. They were like, I'm sorry, our offers are very strict, and that's what the offer was, and you didn't meet the conditional offer. You can do a postgraduate degree and come back if you want. And I was like, shall I not? You know, didn't know what to do. And I thought, you know, if I really want to do this, then that's what I'm going to have to do. So my backup was optometry. And I decided that I was going to go and do optometry because that was the next best thing for me at that point. Now, optometry is a really great career. I know loads of optometrists that absolutely love what they do. But for me, because I had my heart set on dentistry, it wasn't optimum for me. So I went and I was very down. I was really
you actually started optometry?
Started optometry for a month.
Wow.
I was quite miserable, but I was trying my best to be grateful and happy about it.
Yeah.
And I was in my first, I'd made a couple of friends, and you know, I was really trying to like enjoy the first month. I told my friends about my journey, but I was like, you know, I'm here and I'm trying, and etc.
Trying to stay positive about it.
And then I forgot that I had remarked my politics papers. I had requested a remark, but I really put it at the back of my head because I was quite marks away from an A still. So I put it at the back of my head. But I was on the day, I was in optometry, and on the day that I had to pay a huge deposit, I think it was £1,000 for a kit that allows you to do some stuff with optometry.
Yeah.
I had my check in my bag and I was ready to do it. And just before they requested it, I had a phone call. And I was in a lecture, and I went to the bathroom to take the call because it was my college.
Yeah.
And they said, oh, just to let you know, you've had your remark results, and your politics went up to an A. I was like, oh my God, but why so late? They were like, would you like to know how many marks it went up by? And I said, yeah. And they go, 33 marks.
What? And how are they marking that in the first place? How did they miss out 33 marks?
I couldn't believe it, but I didn't question it. Like, I will take it.
Yeah, of course.
But it really, look at the difference between 33 marks in your whole entire life being a complete different pathway. I mean, that's huge.
It's crazy.
Time around. And then I said, and I was just over the moon, and I left City University that day, and I never went back.
That day
I went straight on the tube, went to London Bridge, went to King's, knocked the door of the admissions office and said, I've got the TAs. And they said, and they said, that's great, but, and I said, but your dental classes haven't started yet. It was September 27th or something, 21st. I said, your classes haven't started yet. Can I join? And they said, no, you've got the grades, congratulations, but you can't join this year because we've made all the classes up. And I was like, please. Yet another meeting I tried, and they were not having it. And I thought, you know what?
That's so annoying.
I know. But, well, I've been through hell and back. Maybe I just needed a gap year. They were like, you can start next year. And I was like, okay. And my sister used to start that year. So I really wanted to start with her. I really wanted us to go on the journey together from the beginning. But it is what it is. And I thought, you know what? I need the break. Let me take a gap year. So I took a gap year. And in that gap year, I just happened to meet my husband.
Oh.
Yeah, we got to that year. And then I started dentistry the next year. And then I qualified 5 years later. But that journey for me, it broke me and made me at the same time.
Yeah,
it was like
I completely resonate with it, because honestly, you feel like, why? Like, the amount of times I ask myself, why is this happening to me? You know, and like exactly like how you said, you're not someone that was used to failure, and it just seemed so peculiar that something like this would happen to you. But then I feel like, honestly, everything happens for a reason, and you met your husband in your gap year, and
I think it was so character building, because I prayed really hard. So what I found out from that is a few things. One is that when I pray for something, I really pray from my heart. I feel like God's listening. So I learned that. I learned was failure doesn't mean anything really. It's about whether you decide to pick yourself up and carry on. And also I learned that when you see a door closed, if you still want something, even if the door looks closed, you don't know, like there might be another door. You need to keep trying to kick that door. And look for any pathway that you can push through. And if it gets to a point where you've pushed every door and you have done everything you can, every pathway, and it's still a no, then because some things are just not meant to be. And I was almost there had I not had that. But if you just keep pushing through, you just don't know. And so you've got to keep pushing through. So there's no other option, then fine. Then that's it. Then choose another path then. But not without pushing every door first. 100%. So that taught me a lot. And then it also taught me to never be complacent ever again. So throughout dental school, I studied really well, and I was really prepared for every exam. And I put my head really on it. And really also taught me to appreciate dentistry and never look back. And that's part of the reason why now, you know, I'm really passionate about facial aesthetics as well. I love it to bits, and I could do just facial aesthetics easily, but I refused to turn my back on dentistry because I went through hell to get it. I went through so much training and postgrad training. I love it to bits as well. Like, no, why? You know, why do I need to do that? So I merged the two together, and that's why I won't turn my back on dentistry. I absolutely love it. So it's given me a whole level of appreciation. So that was my journey.
And I feel like it's just so important to trust beyond what you can see. Like exactly what you said about faith. Faith plays a huge part in my life as well. And at that point, I think I lost my faith, and that was a big thing for me, because I was someone that I was very much positive. And if you'd seen me that year where I didn't get into dentistry, I don't think you would have recognized me. I was so demotivated. I think I literally, like, throughout that summer, I would literally stay in bed and just be like, you know, when you just feel like there's no point of doing anything, because you just, everything that you envisioned for your life has just gone out the window. And I think it's so important, trust beyond what you can see and have faith. And I think there is so much to learn from the journeys, because now I consider you to be someone that's super successful, and it's crazy how those 33 marks could have literally changed the course of how your life mapped out. You know?
Yeah, absolutely. Thank you. Honestly, those 33 marks still baffle me, and I can't get my head around it other than just God did something there. but yeah, and so now I get so many people who message me, young, pre-dental school or pre-even medical school or in dental school, saying I've lost stamina or I'm just failing all the time. You know, I can't see through this. I just feel like giving up. And I just want to tell them, literally, nothing is impossible until every door has been closed. Then fine, you know, find a better path for you. But until then, you know, I say don't give up on your dreams, because you never know. Just never know.
Impossible is nothing. People can tell, and even me, like, obviously I didn't see a lot of people that looked like me in dentistry, like, and I was thinking, okay, is this something that's supposed to me and for me? And I felt like you get imposter syndrome. Like I was thinking, oh, am I gonna fit in? And you get all these doubts in your head, and you start to sort of limit yourself, and you start to sort of put yourself in a box and say, oh, okay, this isn't for me. And people, different voices can start to fill your head. And I think it's so important to push past that. People might try and define you, people might try and expect things of you, but you need to just sort of, it might sound cheesy, but believe in yourself that you can go far beyond that. And I think that's what I've done. And people, a lot of people did tell me, oh, Yewande, just try and think of something else, maybe dentistry isn't going to work out for you. And I just didn't want to take that. I wasn't going to take no for an answer. You can't, I want this. You can't tell me what I planned this. And for someone just to say to you, and I think a lot of people try and make your dreams a bit smaller. They'll say, oh no, like, try and think of something else, or that's too big, or, and you can start to believe that. It's so easy to do that, and you're like, oh, maybe I should start thinking of something else, or maybe I can't achieve that. And you shouldn't. Your sex, your gender, your skin color, nothing should stop you from going for what you want. And I'm so passionate about that, because I get a lot of people messaging me as well, like, oh, I haven't seen anybody like me that is in dentistry, and seeing someone like you has really inspired me. And even that little thing, it means the world to me, because I know exactly how that feels.
Well, I've had a whole new, we literally have to create our own ceiling, you know. Nobody else should be able to create that by saying maybe just think about something else, or maybe just give up. And that's the kind of energy you want to let in and out straight away, because it can make you believe it, and that's going to stop you from persevering. But you just have to believe that anything is possible, and you have to kind of correct those people, like, no, look, this is a big dream of mine and I'm going to go for it. And if it's someone really close who's really telling you to give up, you then have to really decide and evaluate for yourself. So I always, there's this saying that really resonates with me, is that you are your own worst enemy. In other words, you're the only one in your own way. Nobody is in your way unless you. So it's only you in your own way, and you just need to get yourself out. And those limiting thoughts, you know, they do crop up. They crop up for everybody. Even now, you know, there's things that we might have goals we want to achieve, and we'll find a million reasons why we think we're not good enough or that we can't do it. It's about getting yourself out of the way, going for it anyway.
What would you say the most difficult part? Obviously, I know your journey was really difficult, but the most difficult part, now that you are 50, you're like 15 plus years qualified now, what would you say?
Qualified. I went into 2005.
Yeah, so throughout your dental career, what would you say is the difficult things that you've had to overcome?
Do you know what? I've really enjoyed my career. I'll tell you what was the hardest part so far. There's been a few, but I'll tell you the hardest part. It was doing 6-day-a-week dentistry. At the beginning of the first few years, I was doing 6-day-a-week dentistry. Because I was so passionate, because I was like, yeah, I love this. And but I ran myself into the ground, and I think I got burnt out. And from my neck locking and me not being able to move my neck, just because, you know, I was so in one position with my dentistry for so long. I remember one day when I was trying to get matrix band on a tooth, and, you know, I like my dentistry. I think that, and I've always felt confident about it. And if I don't feel confident, I'll go and get confident with it. But That day, because I was so burnt out, I was trying to get this matrix band on and it wouldn't go in. And that, it was like, I can usually do this so easily, but it was the same day that my neck had locked, and I think I was pushing on capacity. And that was a real like moment where I thought, well, what are you doing? Like for what? You can't pour from an empty cup. You can't perform well unless you're okay, and unless you're balancing life. And I realized that I was on autopilot, and I needed to kind of do 6-day-a-week dentistry, and particularly in the practice I was working in, which was very fast-paced, and where the patients were really suffering with a lot of dental neglect. So it was hard work. It was cases were tough, and so that was something that I had to then make decisions. And my decision from there was that I could see my health could deteriorate if I carried on, and I decided that I was going to stop after a few years doing NHS dentistry, particularly in that clinic. I wouldn't have minded carrying on, but I happened to have opportunities to do private dentistry because I chose a composite pathway. And the reason why I chose the cosmetic pathway is because I was at a crossroads about then, when I was feeling like the day-to-day work I was doing was quite stale, it was repetitive. I was like, I do a master's because that's what everyone does. It's so trendy to do a master's. And I thought, hang on, but what would I do a master's in? And the fact that I couldn't think of what I wanted to do meant that I would have been doing it for the wrong reasons, because you should only really do postgraduate stuff if you're passionate about that subject, I think, because otherwise you're just trying to collect letters. And I think if you're just trying to collect letters, you're investing a lot of people time in not return much for you. So I did a personal development course called the Landmark Forum in 2006 or seven, and that anyway, no. It was about 5 years postgrad, or 4 years postgrad, and I was like, so it's 2014ish, sorry, and I was like, no, sorry, 2012. It's all come back, and it was amazing. It was mind-blowing, life-changing, and for me, that clarity I got from it was, okay, I understand. What I learned from it was the study of human behavior, how the mind works, and I realized that if I were to do a master, it would have been purely to look good and get letters after my name. It wouldn't have been because I'm passionate about dentistry that much or whatever. And I decided, no, what really makes me happy is to put smiles on people's faces. I know it sounds cliche, but I decided cosmetic pathway. And so I just did loads of hands-on training, really thoroughly enjoyed it, haven't looked back. Don't particularly think that I want to collect letters after my name for the sake of it. I really just want to get really good at the hand skill, and that for me is this. And so for me, I've had lots of clarity because you asked me what are my hurdles. I'd say that, it was that decision making, and then the most recent one is work-life balance, being a mom of two.
Which don't know when to do it all. Did you own a practice as well? Being a mom, it's stressful, and it's just so important to make sure that we're having a good work-life balance. I'm not at that stage of my life yet, but I can't imagine, like, me even being like a single person, like just doing things for yourself, it can be overwhelming. Talk less of having kids you need to worry about and just balancing everything. So have you managed to achieve a good balance, would you say, now?
Oh, do you know what, Yewande? That journey continues. I think that I've achieved a lot more balance than I did last year. So now I'm in a better position. Why? Because I've taken a step back. I work 2 days a week. Again, when I joined private practice, I was working super hard when I had one child, and I was super enjoying it, and I wasn't burnt out because I was doing the dentistry I enjoyed, and it was wonderful. But having the second child changed everything, and now I can't do more than 2 days a week at the moment. I'd run myself into the ground again. My performance as a mother, I think, is so vital that I have to constantly weigh things up. And the hardest thing about that is that I'm really passionate about what I do. So I have to stop myself from taking on some opportunities. I have to stop myself and say, wait, cost benefit here, impact, are kids going to be okay? And what's the impact going to be on my mental health? Am I going to manage it? I have to always weigh things up. And that's really hard because I'm a yes person when it comes to patients, when it comes to, and so I'm just like, yes to everything. But but I've had to kind of pace myself a lot, and that's been really challenging in the last kind of year and a half or two. But I'd say it's still a juggle, and there always will be as a working mum. It just always will be, and I accept that. But it's just trying to find ways and increasing my support network as much as I can.
Oh, it's so important to put yourself first, you know, and
yeah,
obviously, like, self-care. I feel like in this day and age, mental health has become such a huge thing, and I'm so happy that people are taking it seriously, because I feel like a lot of dentists, we are quite headstrong people, and we like to think that nothing can affect us and we're immune to everything, but we are human beings, and you can get burnt out and you will get stressed. So put yourself first, look after yourself, you know. I know it's something that's said a lot, but take it seriously, look after yourself, because if you don't, you won't be able to do the dentistry you love. You won't be able to provide that care to your patients. You know, if your neck, your back, everything is falling apart, you won't be performing at your best. So I think it's so important.
You know, it's so impressive that you've got that already, because you know, as a newly qualified dentist, I didn't really realize the importance of that. And now, if I advice to my younger self, I think the number one thing would be look after yourself, have regular massages, look after your back. Don't necessarily work 6 days a week, you know, unless you know you're doing the dentistry you absolutely love. You know, make decisions about things, weigh things up a lot more. Don't say yes to everything on autopilot. You know, see serve you and serve others. So I've definitely that's an advice I would give to any young dentists. And I see a lot of young dentists like yourself who are so headstrong, and it's so amazing. And you've got really good, you're very grounded. But I do sometimes worry about some dentists who may look at social media dentists, Instagram dentists, and think that, and I'll do anything to get there, and they don't realize how much it can be. It's a very tiring journey, and you do the best that you can, but don't break yourself doing it. Just make sure you enjoy, be present with them.
Honestly, comparison is the thief of joy, and social media makes it so worse. Like, you're constantly seeing this, and you need to remember, so many people on social media, they've been qualified for such a long time. And I always say, compare yourself to who you were yesterday, not who somebody is today. You know, it's taken so people so long to get to where they are, and I try not to, you know, like, I try and make my own plan of what I want to do. And it's always nice, you can get inspired by other people, don't get me wrong, but to just make yourself feel bad because you can't do that level of work yet is ridiculous, because you haven't had that much experience. So I honestly, like, it's so true what you're saying.
I think we have to be really careful with the time I qualified, Instagram wasn't a thing, not like now. And I think had it been a thing, oh God, I don't know how I would have felt, because I really feel for the newer dentists now. I think it's pressure, immense, and I think it can get people really down if they're constantly in the comparison, you know, mindset. And it's so easy to compare. Nobody's immune from that. I mean, we're talking about the most, you know, popular dentists on Instagram suffer with potentially comparison, you know, comparison tendencies, because it's a human thing. And so the only way around that is to not scroll, honestly, to be very selective about who you're exposing your eyes to and your mind to, because that's entering the mind and sitting there, and it's definitely triggering sometimes something both positive sometimes, but also sometimes negative. And it's so important to be choosy about that, and I really can't stress that enough. And I've said in previous slides, and I'll say it again, if my page instigates that feeling to anybody, because, you know, sometimes Instagram will do that. You just look at a feed and you see before and afters and whatever, and it's just like, I want to do that. Or it might be that, you know, but people don't see the behind the scenes, right? They don't see the blood, they don't see the mum struggles. They don't see that sometimes it's not always a, you know, a glam day. And I think, you know, mute me if I've got that impact, because it's to look after your mental health. And so I think that's really important, is to control Instagram and not let Instagram control you. And there's a fine line between the two. That's really important. It's vital, actually, to being mentally healthy.
100%, 100%. We kind of went on a journey there, went to Instagram, social media. So going back to like our journeys now, obviously we both had very sort of different journey, well, similar and different in a way, getting into dental school. Would you say that having parents that were, your mum was a dentist, your dad was a doctor, having people in the healthcare field, was that an advantage for you? Would you say it helped quite a lot, or would you say it was more of a hindrance?
I mean, it definitely, it didn't mean that I had a smooth journey. As you can see, I still had to jump through 100 hoops. What I mean is that I had exposure to those things and helped me make decisions earlier in my years. I think it gave me, it inspired me, of course. My mum is like a big inspiration and I look up to her a lot. It gave me a really true insight, so I was prepared for the good and bad about dentistry, so that's good, yeah. A lot of people, I think, look and think, well, you know, it must have been easy, you were sorted. I've heard so many people say, you're sorted, and actually it was really not like that. When I bought my mum's dental practice 2 years ago, but I did not get it handed on a silver plate. I took a loan, we did all the usual negotiations you do with any buyer, with any seller, you know, and we had to work really hard to make it happen. And about 2 years before we even made the decision, it just wasn't as smooth as sometimes people might assume.
Yeah.
So I was definitely not sorted from that point of view. And it wasn't smooth, but it opened my eyes a lot, and it was I would say helpful. It was helpful in that sense, and it was helpful that I was able to draw on their strengths and continuously look up to them for strength. So
so they didn't like force dentistry on you and say, because I'm a dentist you have to do dentistry. They made you have that decision yourself.
Definitely. We've always had a choice, my sisters and I, and 3 of us did go down the dental pathway, but it was just because we saw it, loved it. Not because we said do it, we just were exposed and loved it, and maybe it's in the blood. I don't know. My dad kind of said, why don't you do medicine? But I think that was more of a competition thing, like, you know, why is no one doing medicine? But I wasn't. I just love surgery, and he's a surgeon, and I love that element, but I didn't like the lifestyle.
Yeah. Wow, it's crazy how both of your sisters and you all became dentists. That's so cool. Like, honestly, Zainab, I find your story so inspiring, like how you were able to navigate through that. And even I resonate so much with it, because going through failure and even going through the phase of not even eating and just losing yourself because you want something so badly, I think it's something that a lot of people will relate to. And my message to you guys is, if a lot of people will get in, that's fine. I'm not saying in order to be successful you have to go through trauma and failure, because that's definitely not it. But if it does happen to you and you don't get in straight away and you are in the position that we were in, don't give up. Honestly, do not give up, because if dentistry, I always say this, if dentistry is something you really want to do, you will find a way to get there.
Definitely. Yewande, you know what, your story, honestly, when I first heard your story, I sent you a message saying I want to discuss it further. Your story, I can't remember where you shared it. It was in a caption. And your UCAS and all of that, and I just thought, oh my god, like I just got goosebumps. I'm like, it resonated with me because of my journey, but I just thought the different background where you literally didn't have any exposure, but you chose it, looked for it, and you jumped through your own hoops, but you know, completely different. It just really, really inspired me, and I think you're amazing, and I think you're going to go really. Watch out, guys. Watch out.
Thank you, Zainab. I think you're amazing. Okay. Thank you so much, Zainab. Someone's just said, Melody, she said, thank you so much for this, ladies. I don't study dentistry, but this was so inspirational. I'm so happy you guys enjoyed it. Thank you so much. Everyone's just saying lovely comments. Thank you guys for tuning in.
Thank you guys. Thank you. Yewande, thanks so much for doing this with me. I'm so glad we got to it, and I know you're going to save it so it'll be really useful for many people.
100%. I know you've got like a busy day, and thank you for just making the time out. And it just shows a lot about who you are as a person. Even though you have so many things to be doing, you make time to give back to others. And I think that's so important, you know, like knowledge not shared is knowledge wasted. And I think it's so important that we're sharing knowledge and just making the road easier for those behind us.
Honestly, I've shared the story for so long on my page, and this has just been the perfect opportunity to do it. The journey into dental school, because again, I think people just really need to know the truth about how it's not always easy, but that's our bottom line. Thanks again, Yewande. You have an amazing day.
Thank you. All right then. Bye, Zainab. Thank you so much.
Take care. Bye-bye.